Thank you for joining.
Thank you. Yes, I'd like to thank Dr. Albouy for what I can only assume is a very flattering introduction on his part. So it's really a pleasure to be here. And I'd like to start by acknowledging my colleagues, Dr. David Bloom and J.P. Sevilla, who I've had the pleasure of working on this research with, as well as Sanofi Pasteur MSD, whose sponsorship made this work possible. So it's really exciting to be at a symposium like this one, where we have professionals and experts from such a range of backgrounds gathered to think about the connections between aging and economic growth. I think the preceding talk really set the stage excellently for a day of fruitful and engaging discussions and presentations. I was especially pleased to hear discussion of the multiplicity of considerations and issues we have to think about when we're discussing aging and economic growth. Yes. So with the next hour, or 40 minutes or so, and then saving time for discussion at the end, I'd like to talk about the contributions that older adults make within society. And particularly, I'd like to take a broad view of these contributions, thinking both about the market contributions through labor and earnings, as well as the contributions that are made outside of the market that we typically neglect. But first, I'd like to provide a little motivation for this exercise, why we should be interested in doing this at all. So, as I'm sure you're all aware, the population of Europe is rapidly aging. And you've probably seen figures like this one before. But just to put a fine point on it, older adults who, I'm going to use older adults as shorthand for adults age 60 and older, made up 16% of the population of Europe in 1980. Today they make up a quarter of the continent's population, and within the next 30 years they're projected to increase to over a third. And the share of adults over 80 and adults over 70 is increasing at an even faster rate than the share of 60-plus adults. So even the group of older adults is becoming progressively older in the years ahead. In France, which is plotted here in the dotted lines as opposed to the solid ones, that's Europe as a whole, France is a little bit ahead of the trend with respect to Europe as a continent. And it's projected to see less growth in the 60-plus population, but more growth in the 70 and 80-plus populations in the years ahead. So it's already been well reviewed by the previous discussion, but I'd like to distill down to the points that are most relevant to my presentation here in the context needed to appreciate it. We know that there's strong life cycle patterns in consumption, saving, and labor force participation. Older adults do not work, earn, save as much as younger members of society, but they do consume more healthcare. As such, there are credible concerns that the population aging underway and ahead for Europe could cause some real economic challenges. But there's no reason to believe that these consequences are inevitable, the economic consequences, that is. Technological, institutional innovation, behavioral change, and policies can all modify what the possible adverse effects of population aging might be. But the question remains as to just how much of an effect these sort of policies can have. So what's interesting is that empirical literature suggests that to date, population aging has not yet imposed any catastrophic burdens on to societies, even those that have experienced the most aging. And I've provided a few examples of this literature here. And the most readily apparent explanation for this lack of economic stress is that aging simply hasn't progressed far enough yet to become truly problematic from an economic stance. So to date, the increase in the elder dependency, which I'm using to refer to just the percentage of the population over 60, has been offset by a decrease in youth dependency, which is called the population below 20 here for shorthand. So comparing Europe's population pyramids for 1990 and 2015, we can see that older adults went from 18% of the population to 24%. But these youth went from 28% to 21%. So if we take total dependency to just be the sum of these two groups, we see that dependency actually decreased by 1% over this time period of 25 years. But the outlook is less rosy going forward. Old age dependency is expected to grow even faster, while youth dependency will only decline slightly. And the net effect of these trends is a substantial 7% increase in total dependency. But presenting dependency by lumping these two groups together as one singular, unified group of dependents is actually misleading and paints an overly pessimistic picture. Defining elder and youth dependency as equivalent creates sort of a false equivalency. Intuition suggests that the group of older dependents would, as a whole, be generally more productive and less reliant on others for support than the group of youth dependents. And you can compare your idea of a typical 70-year-old to that of a typical 10-year-old, right? One is 10 years above the definition for older dependency used here. The other is 10 years below the definition for youth dependency. And you can see there's quite a difference in the level of dependency we're talking about. And it goes for, even if you shift these specific definitions I'm using here, the general results are the same. So research efforts have attempted to account for these productive contributions that older adults make and not write them off simply as dependents. And I'd point to one example, the National Transfer Accounts, which looks at how adults of different ages produce, consume, save, and transfer their resources. And more of these kind of research efforts were just described and will be described going forward throughout the day. But I'd argue that this work and similar research still actually underestimates the productive contributions that these adults make. And I mean this specifically with respect to the contributions they make outside of the normal labor force. So economists typically gauge productivity by measuring the income that individuals generate. And often this is through wages for labor or earnings from self-employment. However, individuals engage in plenty of other activities that create real value, but which don't show up through typical market mechanisms. And these other valuable activities tend to actually spike around the time of retirement and increase. So they're really relevant when we're considering aging in particular. And a few examples of productive activities that are really relevant to older adults are taking care of grandchildren, which can allow the parents or primary guardians of those children to work more or work more productively, can bolster the child development as well. Providing support to friends and family members, which can relieve these caregiving responsibilities of others and allow the individuals supported to be more productive as well. And they also engage in various volunteer efforts. So the literature measuring these productive contributions is kind of regrettably underdeveloped, as is the literature looking at how we can modify these contributions or expand them. So our research kind of seeks to fill this gap by measuring both the non-market and market contributions of older adults and trying to trace the implications of different policies on them and look at the composition of these contributions and their variations. And for the purpose of this study, we define non-market contributions to be just the three activities I just mentioned. So these listed right here: taking care of grandchildren, supporting others, and volunteering. And in order to facilitate comparison and analysis of these contributions, we create a monetary equivalent. We try to attempt to monetize them. And we're currently working to incorporate the value of other contributions into these calculations as well. We recognize that this is, in all, actually a limited gauge of these broader contributions. So in conducting these analyses, we're particularly interested in three objectives. And that's looking at the variations in the composition of contributions made, specifically by age group and along national lines. It's projecting these contributions out to 2050 and seeing how they change and develop. and also looking at the influence of health, of policy, and of changes in the labor market, and how these affect the contributions made. So, and I would like to highlight that this line of consideration is really highly relevant to decision makers, because it should influence, one, it gives us a better understanding of the broader productivity of adults and how these changes in this productivity might scale up to shape macroeconomic trends. And this should influence how we assess policies, technologies, and innovation. So I'll just give an example. If we're thinking of the pneumococcal or the flu vaccine, and we're looking only at the market implications of vaccinating more adults for these and ignoring the others, we may be subsequently overestimating or underestimating the value that these vaccinations confer. And we might under-prioritize them or over-prioritize them in our sort of national health care schemes if we make these misassessments of their value. So taking a more comprehensive view of the productivity of older adults will, one, give us a better picture of what's to come in terms of population aging and its economic sequela, but it'll also allow us to perform better priority setting in our efforts to smooth this transition as it occurs. So this study approaches these research questions using microdata from the Survey of Health, Aging, and Retirement in Europe. And it covers 20 countries, which I've listed up here on the left. Hopefully you can read those to give you an idea. And it follows them for 6 waves, so between 2004 and 2015. The general gist of the coverage is that Western and Central Europe are covered much more comprehensively than Eastern Europe. There are a few reasons this survey is really valuable for pursuing our questions. One, it includes data on employment, earnings, health, and time usage. And time usage is how we get at these non-market activities and how we begin to place a value on them. And it's longitudinal, so it follows the same individuals for multiple years. So we can look at how changes affect a specific individual's behavior and choices. It's designed to be representative of the older population specifically, which is who we're interested in. And it includes enough different countries that we can kind of begin to tease out the effect of policy as well. And so we've merged in some data on official retirement age and population age structure as well. And in the future, we're going to look to expand these analyses to incorporate data on the UK and as well as data from the US for kind of comparative purposes. So the first step in our analyses of these kind of shared data is to get an assessment, measure of the contributions these adults are making right now. And for earnings, we just adjust the after-tax earnings up to account for their pre-tax value with all benefits included. So this reflects the value that the individuals are actually producing, creating, which exceeds what they take home at the end in earnings. And we do this basically the same exercise for self-employment earnings as well. The real methodological hurdle here is valuing the non-market contributions in a way that's convincing and conceptually sound, as well as consistent between these different contributions. So what we do is we set the hourly value of each activity according to what we deem to be an equivalent market activity. So what the going rate for formal labor in that type of work would be. So for caring for grandchildren and providing support to others, this is fairly straightforward. We just look at the wages for caregivers within the country and child caregivers versus in-home personal caregivers. For volunteering, this is kind of a basket of different goods that we don't understand the exact composition of, so it's a little bit more complicated. But what we do is we just look at the elementary wages, average elementary wages within the country, and we take the hourly earnings of the individual, and we take the average of these estimates to produce our estimate of the value of each hour of volunteering. And the rationale behind this is individuals can do low-skilled volunteer work, might be chopping carrots at a soup kitchen or cleaning up a park, or they can also do their normal labor free of charge, so pro bono legal representation or something of this nature. And they can do everything in between as well. So we take the average of the estimates of their hourly labor and those of the kind of basic unskilled labor, and that's what we use to approximate the value of those volunteer efforts per hour. So I'll note that this requires that we actually estimate the earnings of individuals who are not currently working but are engaged in volunteer efforts. We have to have some way of assessing what they would be making if they were in the actual market. So typically and I won't get very bogged down in the technical aspects of this, but typically in these sort of models, log linear earnings models are used. But for predictive purposes, they actually underestimate the value of contributions made by individuals. And there's methods used to kind of adjust these estimates upwards, but we found that for our purposes, a Poisson model of earnings was actually much more effective. And yeah, like I said, I don't want to get too much into the details, but basically we verified that by taking half the sample and estimating the model using that, and then using that to compare our predictions for earnings to the actual earnings of the other half of the sample, and did a sort of half-sample cross-validation for repeated trials, and we found that this model was actually much better. And I would refer, for people who have questions about this, I would refer them to this source that's cited here, which kind of discusses a similar model for use in a trade application. And there's another source of bias that the model doesn't address yet, but that we're working on, and that's the idea that we use the earnings of individuals who are working to estimate the earnings of individuals who are not. And to some extent, employment and earnings are likely correlated. So one might expect that individuals who earn less or have potential to earn less might be more likely to not work because they have sort of less incentive to do so. So with this effect, there would be kind of an upward bias on our estimates of the possible earnings for individuals who aren't working. And there's also kind of countervailing factors that might suggest the bias moves in the opposite direction. So currently we're working on incorporating a Heckman correction to kind of fix this. And our early results suggest that the effect isn't very strong, or it doesn't matter very much for our purposes. So anyways, following this methodology, we're able to estimate that the average hourly value of volunteering for older adults is around 24 euro. The value of spending time looking after grandchildren is roughly 19 euro per hour, and providing support to others is estimated at 21 euro. And of course, this varies by country, but this is the average across the sample. So among the sample, 20% of adults looked after grandchildren to some degree, 22% provided support to others, and 15% engaged in some volunteer efforts. So we see that many older adults are doing these types of activities. It's not just a small percentage. And over the course of the year, the average older adult, this is of all older adults, those who did and did not participate in the activities, spent 142 hours caring for grandchildren, 77 hours providing support for others, and 45 hours volunteering. Adults who did look after grandchildren spent about 13 hours a week doing so, and adults who supported others spent about 6.5 hours per week doing so. And volunteering was both less frequent and less time-consuming when it was actually undertaken. So utilizing these kind of time use data and our estimates of hourly productivity, we find that the average adult in our sample created about 5,250 euro of non-market value in the year preceding the survey. And nearly half of this value comes from taking care of grandchildren. In some countries, more than 70% of this value comes from taking care of grandchildren. So this is a particularly important activity. Providing support to others was around 29% of the total value here, and 22% came from volunteer activities. And I'll just note here quickly, some might have qualms about our estimating the value of volunteering as we did. We're essentially assuming that half of all volunteer efforts are unskilled and half are skilled, but we really don't know the actual composition. But it turns out that the composition doesn't matter much. Even if we assume that all volunteer efforts are unskilled, our estimate is €5,000 of value created. If we assume all volunteer efforts are skilled, it's €5,500. So it's only about a 5% swing in either direction. And we can see that's because volunteer efforts are a relatively small section of the non-market contributions here. Okay. So rolling these non-market productivity estimates together with earnings data, we're able to more comprehensively estimate these contributions of older adults as a whole. And I've plotted them by country here. So what you'll see is the blue represents the average earnings on a country-by-country basis. Red represents average indirect value created. And then the black dots here are the total value created as a percentage of GDP per capita. And of course, in the non-market value isn't included in GDP per capita calculations, but this is just to give you an idea of the relative value of these contributions compared to the average income in the countries. So there's a few takeaways I'd like to highlight here. One, most importantly, is that these contributions are substantial. On average, they come to around 34% of GDP per capita, but there's a lot of variance on a country-by-country basis. In Switzerland, Denmark, Sweden, and Belgium, as well as Germany, these contributions are over 45% of GDP per capita. In Slovenia, Czech Republic, Estonia, and Poland, they're less than 20%. And the general trend we see here is that more wealthy countries, generally the contributions of older adults, even relative to national income, are higher in wealthier countries. So if we drop Luxembourg from the sample, which is kind of an outlier with respect to this trend, we see the GDP per capita and the contributions of the elderly relative to GDP per capita have a correlation coefficient of 0.52, and you can just see visually there's some moderately strong correlation here, and most of this is driven by earnings specifically. So looking at earnings versus GDP per capita, we see a correlation coefficient of 0.72, which you can just visually see is pretty strong. And there's a few reasons we might expect this. One, adults in wealthier countries tend to be healthier, and they tend to be better educated. Healthier adults will tend to stay in the labor force longer and retire later. Better educated individuals tend to have earnings that peak later in life. So this would kind of explain why these contributions might be higher, and I'll show some results that sort of support this in a little bit. There's still a lot that's unexplained in this association as well. So returning to this chart here, the other point I'd like to highlight is that non-market contributions are a really important part of this picture. On average, they come to about 9/10 of the mean earnings of individuals. So we're almost doubling the contributions of the older adults when we consider these non-market factors. And in some countries, they're nearly 4 times as large as earnings. So that's in Portugal specifically. And in Luxembourg, Spain, Slovenia, they're also roughly 2 times as large. But even on the low end, the non-market contributions aren't insignificant. So even in the countries with the lowest relative non-market contributions, they still come to around a third of the average market earnings of these adults. So looking closer at the data for France here on participation, we see that 31% of older adults helped support others, 26% looked after grandchildren, and 22% volunteered. So those are higher than the cross-sample averages. Those who cared for grandchildren spent 9 hours a week doing so, while those who provided support to others and volunteered spent around 6 hours a week. And hourly productivity in each of these activities was also above the sample average. So less of the 60-plus French population was employed compared to the overall sample, 15% versus 17%. but those who were employed worked for around the same amount of time, and their hourly earnings were substantially higher. So 35 euro per hour compared to 28 euro. Within France, the higher earning members of the working population, the older working population, generally worked fewer hours. So older French adults who worked 35 or more hours earned an average of 27 euro per hour on average, while those who worked less than 35 hours earned an average of 47 euro per hour. And this is primarily driven by very high earners. So there were plenty of adults who worked part-time and didn't necessarily earn very much, but of adults who earned more than 100 euro per hour, the majority worked less than 20 hours per week, of older adults specifically. So the average value of overall contributions in France, both market and non-market, came to around 12,200 euro, which is higher than the mean for the sample overall of 11,300 euro. And just a narrow majority of this value came from non-market activities, 53%, compared to 47% for the rest of the sample. So in France, the non-market activities were actually a bigger factor than the market earnings of these older adults. And volunteering and supporting others are more important components of the French contribution compared to the overall sample size here. So just returning to this chart one more time, we can see that France indeed falls close to the middle of the pack in terms of overall contributions of older adults as a percentage of GDP. And this is roughly in line with my earlier point about the association between GDP per capita and the relative contributions of older adults. This is roughly where France would fall in terms of average income. But I'll also point out that some of the variance we see here is across countries can be attributed to differences in the age structure of the 60-plus population. So unsurprisingly, overall contributions, which are represented in black here, decrease with age. But what we'll notice is that the mean indirect value, or mean non-market value created, falls off at a much slower rate than the earnings, which are represented in blue. And what you'll also notice is that by age 70 and above, the value of non-market contributions typically dwarf those of earnings. So what this suggests is, as I mentioned earlier, the 70-plus population is growing much faster, relatively speaking, than the 60-plus population. So considering these estimates of non-market value should only become more important in the years ahead as the age structure of this older adult European population continues to skew older. And indeed, this is what our projections going out to 2050 reflect. So they show an increasing portion of these overall total contributions coming from the non-market means in red. And we expect the non-market value created to be equal to the earnings by 2038. That's what our projections suggest. So we scaled these contributions up to the aggregate level just by multiplying each individual's contribution by their population weight. And the total contributions for 2015 came to about the 10th of the GDP of the 17 countries included in the sample. And we project these aggregate contributions into the future just by reweighting each individual's contribution relative to the growth in their age, sex, and country-specific population to each future year. And I'll note that these are the absolute contributions of older adults in euro, but their relative contributions as a percentage of total contributions will actually exceed these as the population of younger adults shrinks, relatively speaking. And I'll note that our model also estimated a positive relationship between the percentage of the population working age and the contributions older adults make. So meaning in societies when more adults fall in the typical working ages, older adults actually tend to contribute more as well. But we didn't think these were appropriate. This relationship was appropriate for simulating the future contributions because we expect that this relationship may change as the percentage of the population older grows larger and larger. And there's endogeneity issues here as well. So in France, older adults are responsible for creating 200 billion euro of value and 96 billion in non-market value, 96 billion in earnings, 107 billion from non-market activities. So this is roughly around 9% of the GDP of France. And adults make up about a quarter, older adults make up about a quarter of the population, to get an idea of those contributions relative to the population size. So the gap between non-market contributions and earnings will only continue to widen, and by 2040, non-market contributions are expected to total at 132 billion euro, while market earnings are expected to remain roughly equal to their current value. So the next step in these analyses was to develop a model that could simulate shifts in projections of aggregate contributions under alternate scenarios. So for earnings, this is formulated as a two-part model, and again, I don't want to get too bogged down here. But basically, we use a probit model to estimate the likelihood of an individual being employed, and then the Poisson earnings model to estimate their earnings, assuming that they're employed. And then we can multiply these two values together and get an idea of what their earnings are expected to be, regardless of whether we know their employment status or not. And value of non-market contributions are modeled in kind of an analogous manner. And the same explanatory variables I mentioned earlier, age, sex, education, self-reported health status, year of interview, country of residence, are used in this model. And so I've highlighted a few important implications of the model here. So these are the marginal effects it means, but basically the interpretation of this is these numbers show us how much changes in the sort of explanatory variables on the left affect the different dependent variables up top for the average member of the population. So it's probability of employment on the left, earnings, conditional on employment, probability of non-market participation, and value of those activities, conditional on participation. So what we see is, in many cases, there seems to be a trade-off between market productivity and employment and non-market activity. And this kind of gets at the importance of doing this exercise, is that non-market activities in many cases do not move the same direction as the market contributions. So being female is associated with 10% lower probability of employment as an older adult, and nearly 12,000 euro less in earnings conditional on employment. And this is a result of both lower hourly earnings and a fewer number of hours worked on average. However, being female is also associated with a 5% increase in the likelihood of participation in non-market activities, and an increase in the value of those activities in the instances where individuals do participate, roughly equal to 1,700 euro in magnitude. So older retirement ages were also associated with a greater probability of employment, but reduced likelihood of participation in non-market activities. And countries with the higher percentage of the population working age, again, saw greater employment, but lower non-market participation. On the other hand, better health and greater educational attainment were associated with both greater productivity through market mechanisms and greater participation in non-market activities. Moving to our first simulation here. What we see, the dotted lines on the chart show the estimates of, or projections of productivity under the alternate scenarios. So this is specifically a scenario in which the retirement age is raised to 67 in each of the countries participating. And age 67 is chosen because this was the oldest retirement age. So think full pensionable age, official retirement age, of any group within the survey, and that's applying to males in Greece. So we thought that simulating an increase to retiring at 67 would be significant for most countries in the sample, and appreciable, but also not necessarily absurd. And what we see, again, earnings are plotted in blue. the dotted earnings are under the alternate scenario compared to baseline. Indirect value is in red, dotted again. So we see that there is an increase in employment and thus in earnings by raising the retirement age, but that this increase is essentially offset by a decrease in indirect value or non-market value created of roughly the same size. And the overall effect on contributions is essentially negligible. It's unappreciable. It's within the margin of error of being zero. So this is kind of an interesting conclusion because it suggests that while raising the official retirement age may be necessary in terms of supporting solubility of public pension funds or bolstering tax revenues, we might not actually be inducing any more productivity at all when we look at it from this broader angle. And I'd also point out that because there's aspects of non-market productivity that we're unable to capture with our current framework, if these move in the same directions as the ones in which we are able to capture, the effect might actually be negative on overall productivity by raising the retirement age. And in France, the general effect is the same, but the magnitude is larger, due to a larger increase in retirement age compared to the average for the sample. But again, the net impact is the same, and that's that there's really no appreciable effect on overall contributions. Again, not to get too bogged down, but simulating changes in health is more complicated. We essentially rely on the assumption that changes in the retirement age are exogenous, which some might argue with, but it's certainly safer than assuming changes in health are exogenous. There's a two-way relationship between health and income. Having better health does support greater earnings, but we also know that earning more supports better health. So we can't just look at the association between these two and attempt to make guesses about changes in health based on that. So the approach we use to this is utilizes a method from this Trevisan and Zantomi paper. And basically we take adults, we look at the entire sample of Chaire, and we find adults who are interviewed in at least 2 rounds and who had not experienced an acute health shock in the first round of their interview. So acute health shock here refers to a first incident of heart attack, stroke, or the onset of cancer. So we find all adults interviewed for multiple waves who had no incidence of any of these conditions at the initial interview. And then we divide them into 2 groups, those who later had an incident of one of these 3 conditions and those who did not. And basically we look at the difference, because after successive waves, all of these adults will be participating less in the labor force and generally contributing less as they get older. But what we want to isolate is the difference in difference between these 2 groups. So how much more do those who experienced a health shock tend to drop off their contributions compared to those who didn't experience a health shock? And we also use propensity score matching to try to match adults who did experience a health shock to similar adults who did not. So we're not comparing apples to oranges as we make this comparison. So this is kind of a list of the controls we use for the propensity score matching, and you can see we have a lot of things where we are able to find adults who are really very similar in terms of what we would expect their earnings and health status to be, apart from this specific difference in the experience of an acute health shock. And I'll caveat that we're still tweaking our application of this approach, but our early results suggest that health shocks reduce the probability of employment by 8.8% on average. So this is actually a really appreciable reduction because on average only 17% of our 60-plus population is employed. So an 8.8% reduction in employment is basically cuts the chance of employment less than in half. So in addition, health shocks are estimated to reduce participation in non-market activities by 1.9%. And I'll note that this isn't a statistically significant finding, but what we can state with confidence is that health shocks certainly do not appreciably increase the non-market contribution. So unlike raising the retirement age, it's not it doesn't increase earnings at the expense of non-market contributions. It increases earnings, and it, at the very least, holds non-market contributions relatively fixed. So applying these results suggests that a 5% decrease in the incidence of first-time acute health shocks among older adults could lead to a 2.5% increase in the market contributions made by this group. And this totals around $2.5 billion in the French case. And increasing these acute health incidents would have the opposite effect. So another way to conceptualize this is average increase of, for each health shock averted among the older population, market contributions are increased by an average of €2,500 per year, which is substantial. So, in conclusion, older adults make substantial contributions to the economy, even if these contributions aren't quite up to pace with their population share. Non-market labor activities comprise a significant portion of these contributions, and considering non-market productivity can change our conclusions about policy options. It has the potential to make improving health look more attractive as a means of addressing certain economic issues than raising the retirement age. And I'd just like to note by closing that this research is really, close by noting that this research is really just opening the door for an exploration of these topics. And there's plenty of avenues for valuable research on the contributions of older adults. Just an example to think about how these non-market contributions might show up in market contributions later. So, for example, taking care of grandchildren. How does that increase the labor market participation of primary caregivers, and what are the fiscal implications of this? So with that, I'd just like to conclude there.